On this episode of Bondi Vet,
Oh my goodness. I heard you two were in the house. I feel like they're celebrities.
Kate worries a famous dog could have a life-threatening condition.
Thinking that there might be cancer has been on my mind all day.
All we can do at this point is just cross our fingers.
He's not walking properly. Yeah.
Can Lisa save a cat's life with a radical haircut?
If that toxin starts to paralyse his breathing muscles, then he could die.
How is our little chap going?
Nothing's come up, so to speak.
And Scott tries to help a puppy with a not-so-big problem.
We knew there were some potential issues with his manhood.
They do say dogs take after their owners.
You make my world a better place.
Come on, there's your girl.
I can depend on you.
Come in. Hi, how are you?
Hello, how are you?
Good, thanks. I got Bear here.
Hi there, hi Bonnie.
At the Bondi Vet Hospital, Jeff has brought Bear and Bonnie to see Kate, and their arrival is turning heads.
Oh my goodness. I heard you two were in the house. I've been waiting to meet you guys forever. Bear and Bonnie. Bear and Bonnie have their own chicken and kangaroo jerky. And that might not mean much to other people, but to me it means a lot. I feel like they're celebrities.
Good girl.
But the famous duo aren't here to sign autographs. Recently, Jeff noticed some worrying bumps on 10-year-old Bear.
Got a few lumps that we're concerned about. We're hoping it's not cancerous. Bear's super important. He's more than a family pet. He's like one of my kids. Can't imagine being without him.
I know. Hello, Bear. You're funny. How are you?
Yes.
Okay, big boy, let's go. Come on. Come on.
Come, Bonnie.
You're salivating all over the floor. There you go, Bonnie. Good job. Good job. So Barry's got some lumps on him.
Got some very concerning lumps.
Yep. And have they been there a while?
I've noticed them more the last few years.
Okay. Approximately how many lumps do you think he's got?
I think there's about 5, but there may be more.
Okay. So, number 1 lump. Number 2 is left-hand side. We've actually got 2 under here. Left hand underarm. So there's 2 lumps on top of each other. Then we've got a giant lump under here. So this is obviously the one that you're quite concerned about.
Yeah, it's quite solid, that one.
You've got lumps on lumps, kid. So not uncommon in a Labrador, right?
Okay.
As they get older, they really do get to a point that it feels like sometimes more lump than dog. They also are prone to getting cancers. A lot of the time they're just lipomas. They're just benign fatty tumours. However, that doesn't mean that just because you've got one lipoma that all of them are lipomas. So I'm going to get him booked in up at the Small Animal Specialist Hospital up at North Ryde and put him through a CT scan.
Well, I'm happy with that. Everything's for his health. I'd do anything for it. So the CT scan's the way to go, I think. All right, thank you, Dr.
Okay,
Kate.
guys, I'll see you next week. Next week, Bear, you and me.
Okay, there we go. Good boy.
A few days later, Bear has arrived for his crucial CAT scan.
Come on.
Hello. Hello. Hi, Bon. Hi, Bear. Hello, sweetheart. So today's the big day.
It is.
I know this is quite nerve-wracking.
Yeah.
How are you feeling?
Yes, a little nervous, but I'm hoping for the best.
All we can do at this point is just cross our fingers.
Yeah.
Come on, this is the way. This is the way.
I'm a little concerned about what it's going to find. I think the worst case would be it's cancerous, and we would have to, I don't want to think about that right now.
Come on. Okay, bye guys. Come on, let's go, let's go. Bear is a really, really special dog. I have a real soft spot for Chocky Labs. So it's really important that we check out every single one of these lumps and make sure that all of them are benign.
Bear has been mildly sedated to keep him still during the all-important scan. Kate watches anxiously as the images of the 10-year-old's ageing body are taken.
So what are we seeing here?
This is skeleton.
Wow.
If there is like a cancer tumor, then it will really uptake. So when we look at it, it will be just like a light bulb for us.
Okay.
It's like, oh, okay.
It's very high tech.
With the scan complete, radiologist Dr. Richard and cancer specialist Dr. Veronica will examine the images of every part of Bear's body, including his brain.
Alrighty, so he's got a small lipoma sitting within the brains, and that's actually fat.
So it sounds like it's less likely to be something malignant.
It's hard to know.
There was something that came up from the CT scan in Bear's brain. The specialists don't really know what this is. So what's been recommended is that we actually go back in about 6 months' time. So re-CT his head and just have a look how that's behaving. So there's his elbows.
Yeah,
Yep.
he's got a lot of osteoarthritis already in both.
And would you call this severe?
Yeah, severe elbow arthritis.
After finding arthritis in Bear's elbows and a fatty growth in his brain,
He's got some lumps here in the mammary kind of area. He's got heaps of them.
Correct, yeah.
Kate now anxiously waits for the verdict on the lumps she found when examining Bear.
I think a lot of these lesions that we're identifying are almost purely fat. So all of this is intra-abdominal fat, and you see he's got another intra-abdominal one. All in all, I think it's pretty standard Labrador type changes.
I feel like standard Labrador is a very good diagnosis. Standard Labrador, that's all we want to hear.
It's a good disease to have.
Yeah. The outcome from today has been absolutely awesome. All of these lumps are lipomas. Even the really giant lump has turned out to be a lipoma, just a benign fatty tumour, something we don't really have to worry about. Yes, it is growing, and yes, we probably need to take it off, but this is the best news that we could possibly have got. Hello, buddy. How are you? You pretty much got the all clear, buddy. It's good news. Your dad's going to come to get you soon. He's going to be very glad.
Outside, Bear's devoted dad Jeff and best friend Bonnie are also nervously waiting to learn the fate of the much-loved family member.
Yeah, Bonnie and I have been anxious all day waiting for Bear's results. Thinking that there might be cancer has been on my mind all day. It's making sick in the stomach. Bonnie, his little sister, she comes for moral support. She doesn't leave his side. You go, hello, my boy.
Hi.
Hey, who's that, Bonnie?
Am I glad to see you, Dad?
Hello. How did he do?
He did really well. He was such a good boy. I've got some really good news for you.
Right.
There is no cancer.
That is good news.
So that giant lump on his side is actually a benign fatty tumour.
Right.
It does seem to be growing though.
Okay.
Right, so it's probably at some point consider taking it off.
Yes.
He's got a fatty lump in his brain, but it looks like it's probably nothing to worry about.
Okay.
He's got some serious arthritis in his elbows.
Yeah.
His elbows are absolutely shot. Bear would be suffering, so it's really important that we get on to looking at how we can pain manage these elbows. Everything else looks a-okay, and they called him a standard Labrador, which I thought, yeah, that's what you want to hear.
Well, that's good news anyway. Mm-hmm. You doing all right?
So it was well worth it, wasn't it, buddy? It's been a big day for him.
Yes, it has.
Bonnie, have you missed him?
She's been anxious the whole afternoon.
I thought that you guys might have some separation anxiety.
Yes, me too.
Yeah. I love these moments. I love being able to give dogs back to their owners with really good news. Jeff and his family are really attached to Bear, and I couldn't have asked for a better result. Okay, buddy?
All right, thank you very much.
See you, Chook. Bye.
Well, cast this way.
Bye, guys.
The good news is he's got no cancer. So I'm happy that at this stage, it's all good news. There we go. Yeah, I'm sure he's looking forward to his favourite barbecue chicken when he gets home.
As a vet, the best advice that I can give pet owners is this. Think carefully about the choices that you make on behalf of your pet, and you can literally save their lives. And if you make healthy choices, you will have a healthier pet.
In St Margaret's in southwest London, Border Terrier Wellham looks and acts like a normal, healthy 18-week-old pup.
Oh, good catch.
Especially during playtime, with his dad Barda and owners Martin and Helen.
You're doing your biggest brave dog growl, hey?
But in Wellham's case, appearances can be deceptive.
So Wellham's got an issue with his man parts. So I'm not quite sure if this is the right terminology as well, but apparently he's got a micropenis.
They do say dogs take after their owners.
They do, yeah, quite. So despite the fact he's quite a big lad with big paws, he's not going to grow into his manhood.
We aren't going to be the couple with the micro-penis dog. We can't take them out anywhere ever again. Wellham won't be able to hold his head up in St Margaret's.
He's going to get bullied at puppy school.
He will get bullied at puppy school. So easy.
The condition can be serious. If the penis doesn't grow, the empty space around it can be prone to ongoing infection.
He's a big, roughy-tufty puppy who thinks he's a Rottweiler at least, and yet he's got a micro-penis. It's awkward, isn't it? Sit.
But little Wellham has another more urgent problem. He's almost 6 months old, but still has one undescended testicle.
Today we're going to go and see Scott to talk about the next steps. So after the initial consultation at 8 weeks, we knew he needed to go back to kind of explore what was going to happen.
You're not having it, are you?
If there's no change in his condition, Wellham will need invasive surgery.
I can't say I'm massively looking forward to leaving him at the vet's whilst he goes under for an operation.
Yeah, the idea of putting him under the knife isn't very appealing. Anything to do with an anaesthetic and putting him through a procedure like that, but equally something as intimate or personal as that. I don't want to change who Wellham is.
Good boys.
Hey Scott, how you doing?
Hey Martin, good to see you, mate. How are you?
Yeah, good, thanks.
Hello,
Good, you?
boys. Hello, are you okay? Hello, monkey. You're in trouble, aren't you?
All right, come on in, let's have a chat.
Alrighty, come on, Bard, let's go.
Come on, boys.
This consultation is a follow-up from Wellham was 8 weeks and brought him in to meet Scott for his first round jabs. We knew there were some potential issues with his manhood, shall we say.
Oh, I love a Border Terrier puppy, yes, I do. How's he been getting on, Martin?
It's been great. He's absolutely brilliant, yeah. Yeah, he's settled in really nicely. Bard has been brilliant with him. We're just going through the teething stages at the moment.
How is our little chap going?
Nothing's come up, so to speak.
Well, what we're going to do is, if I can just get him leant this way,
Sure.
and then I can just have a look.
All jokes aside, the problem can be quite serious.
It is an issue where they've got a prepuce, which is the sac that the penis sits in, and because it's not being filled properly, it does then expose the dog to infection and build-up of discharge.
Scott is hopeful that with time, as Wellham approaches maturity, his penis will have grown to a normal size.
It doesn't seem to be affecting Wellham at all. He's still a boisterous, fun-loving puppy.
Now to find out if there's any improvement in the young dog's testicles.
So what I want to do is we'll spin him round, and I just want to have a little feel of his testicles now.
Okay.
Now, the problem we encountered before was that he only had one testicle.
Yep.
His right testicle I can feel.
Okay.
But no left testicle.
There's none there, okay.
No.
And is that because it's not developed, or is it stuck up inside him somewhere?
Unfortunately, it will mean that it is inside his abdomen.
Okay.
Poor little Wellham has a condition called cryptorchidism, which is basically where one or both of the testicles haven't descended properly into his scrotum, which is the bag on the outside. The testicle tucked up in the abdomen overheats. That overheating can lead to mutation, and mutation is the basis of cancer.
Scott is recommending that to safeguard against Wellham passing on the genetic condition, both testicles will be removed.
He's not really breeding stock.
All right, little man.
Exactly.
All right.
Hey.
Well, you just have to be the fun party guy, won't you?
Yeah, you'll have to be the good-looking guy. Hey, what do you think?
Wellham's surgery will be scheduled a few weeks from now, when he turns 6 months old.
You gonna be a good patient today?
Yeah. You don't be nervous. This is going to sound really wrong, but I'm looking forward to seeing the size of this penis.
Wow, that's something you've never uttered to me before.
It's time for Wellham's surgery, with nurse Gemma assisting.
There we go.
Yeah, that's not too bad, is it? Brave boy.
But first, Scott wants to see if there's any good news to report on Wellham's micropenis condition.
Now that Wellham's well and truly under anaesthetic and he's nice and asleep, we're going to just examine his equipment and just see how it's getting on. Well, it does seem like the young man is, well, he's certainly gained
Had a growth spurt.
Yes, he has gained some inches, which is great. I mean, he's really filling that sack now. I can leave you Willie alone, mate, which is good, isn't it? Yes, a man's prerogative is to have it left alone when he wants it left alone.
So it's just a normal penis, not
Yeah.
micro anymore.
Not
well
micro.
done, Wellham. Your dad will be very proud when we tell him.
But we'll have to prepare for removing this testicle and
Yeah.
then going for our fishing expedition. All right, let's see if we can find this testicle, shall we? So we know it's on the right-hand side. That's it. So now I know where I need to go in. I need to go in right there.
Yeah.
It's almost certain that when a dog suffers with cryptorchidism, which is basically where both testicles aren't in the scrotum, that it is genetically inherited and it can be passed on from parent to offspring. So as far as Wellham's concerned, it's the right thing to do medically, but also ethically to ensure that he doesn't pass this on to future generations. So I'm ready to make my first incision. Right, so I've got it. He's a little fella, but perfectly formed, and thankfully it's come out relatively straightforward. So now his testicle, it's now going to be taken away. So that's just about the first one closed up, and then we can move on to the testicle that's in his little scrotum there. So you can see that's significantly bigger than the other side.
And there they are, in all their glory. Very beautiful.
Really?
No.
There you go, Wellham. Two nice little suture lines, and no other boy will be able to tell the difference. Yay.
Hello.
Oh, sweetheart.
Well done. Oh, Bubba. Oh.
Yeah, you're all right. You're all right.
He's probably going to be feeling a bit groggy and not really 100% coming around from the anaesthetic because of all the medication. So he's coming around nicely, but yeah, he is being quite vocal.
Oh, well, we're breaking our hearts.
Come on, you're okay. Come on.
After the successful operation, Wellham is making his feelings known.
You tell me all about it.
Yeah.
Hi.
Hi, Gemma.
Hello.
Thought we'd bring Barda with us for the pickup.
Ah, you come to see your boy.
Quite like being back on your own, haven't you?
Oh, you had Mummy and Daddy to yourself. Well, have a seat. It's got to be up shortly.
Cool.
Okay, all right.
Upstairs, owners Martin and Helen are looking forward to being reunited with their little boy.
If he's in any discomfort or pain, then I think he'll like to see Helen anyway. He's quite a mummy's boy.
Hi, guys.
Hey, Scott.
Hey, here's your boy.
Hello.
Hello, little man. Hello. Oh,
Hello, mate.
Oh, look, both daddies are very excited to see you. Hey.
hello, Papa. Yes, hello. I'm here. I know I've got you.
It's been quite a traumatic day for poor little Wellham.
Silly cone of shame's in the way, isn't it? I know, I got you. I got you. Hey, such a wuss when it comes to cuddles with me, aren't you?
Furry baby.
It's really lovely to see his whole family turn out to welcome him back into the fold with Helen and Martin and also Dad Bardo.
There he is. Here he is. There you go.
Well, good news is, Dad, is that your boy could no longer be classed as having a micropenis.
It's great news.
In fact, he has, well, I suppose, a normopenis. But as far as the testicle is concerned, that's also good news. We removed the one that was internal, and although quite a lot smaller than the other one, perfectly formed, no form of cancer or anything present. So that's really good news, isn't it, mate? Yes. And then, of course, he's then been castrated in the normal fashion.
Yep.
So I noticed that Dad is very closely looking at my handiwork. All right, guys. Take care.
See you.
All the best.
Thanks very much. See you soon. Take care.
Cheers. Bye.
See you, Gemma.
Bye. Bye, boys.
Come on, little man.
See ya.
He doesn't seem that bothered, does he?
No. No, he's totally fine.
It's just a cone of shame that's the problem.
I think he's still friends with you.
Lisa, this is Pickles. The owners are a bit concerned because he's not walking properly.
Yeah.
And he's been moaning.
Okay. Hey, sweetheart. Can you come out?
6-year-old ragdoll cat Pickles has been rushed into the Bondi Referral Hospital SASH with some distressing symptoms.
He's not really moving his legs very well. There's a bit of movement, but they're really weak.
Owner Jenny became concerned when she noticed some worrying signs at home.
He started not moving properly. We noticed that he couldn't jump up onto a ledge. His back legs seemed to be not working.
All right, sweetie. As soon as I see Pickles, I can tell straight away he's not walking the way he should be, and his meow sounds different. To me, this is pointing to a tick, but it's really out of season, so it would be very unusual to get one at this time of the year, but all his signs are pointing towards that. The coat is so thick that if he's got a tick, it's not going to be easy to find it. I'm running my hands through Pickles' fur, and it's something that's making my job very difficult. The longer that tick is left on his skin, the more time it's got to inject that potent toxin into his system. Okay, I think I found something. Yeah, that's a big one. There it is, a paralysis tick. Now, this can be deadly for Pickles. He's already showing the signs. I need to get this little creature off as quickly as possible. Oh, you're a brave boy. He's really stuck in there. Okay, here we go. Got it. That is a big tick. Okay, we got our answer. Let's get him treated.
Okay.
The next step is to give Pickles some tick anti-serum, which is kind of like snake anti-venom. It's going to go into his bloodstream and bind to any of the toxin that's circulating there to prevent him from getting worse. All right, sweetie. I'm going to get this tick anti-serum into you. Okay. All right, Pickles, we're going to pop you in the bed now. Okay? That's the way, sweetie. Animals that have tick paralysis can get worse and quickly, because if that toxin starts to paralyze his breathing muscles in his throat and between his ribs and his diaphragm, then this cat could end up on a ventilator. All right, Pickles. Hey, you're a good boy.
Lisa now needs to break the news to Pickles' anxious owner Jenny and her kids Jessie and Amy.
Hi, I'm Lisa.
Hi.
We found a pretty big tick on Pickles' back.
Okay.
You want to come and see him?
Yeah. Yeah.
Come through.
Okay.
They'll be allowed a brief visit to see their beloved pet before he settles down for the night.
He's just through here, having a little rest.
Oh.
Give him a big cuddle.
Hey, sweetie. Hey. Hey. Oh, he's still so quiet, isn't he? Look at him.
It's really important that he's monitored quite closely in hospital. They can get worse in the first 24 to 48 hours before they get better. We just got to hope that he doesn't get any worse.
Yeah.
We're also going to then give him a bit more sedation and shave off all his hair. We need to make sure that there are no other ticks hiding there.
Seeing him in the cage like that was actually a bit scary. I think thinking that the tick was out made me think it was all going to be instantly okay, and it's not necessarily, so that's a bit scary. All right, well, I suppose we should leave you to do your magic.
Okay, Mr. Pickles, you're going to stay with us, buddy, and we'll be in touch.
All right. Thank you.
That's no problem, thank you. Jenny clearly adores Pickles. She wants to do whatever it takes to get him through this. She thought, we'll give him the tick anti-serum and he'll be out the door. But when I tell her the news that it's 24 to 48 hours, that he could deteriorate despite us treating him, is terrifying for them. All right, Pickles. I know he's got a beautiful coat, but we've just got to get all this hair off and make sure there are no other ticks hiding there.
As life-saving anti-serum gets to work, Pickles is undergoing a radical precautionary haircut.
So there's no more ticks, which is great. So we'll just keep a really close eye on him now. Keep him nicely sedated and watch his breathing. Okay. Some animals will follow the textbook and get better within a matter of time. Others will seem like they're okay and they'll deteriorate out of the blue. We can't take our eyes off Pickles because if he gets worse and we miss it, then he could die. All right. You're okay, Pickles.
Pickles will now spend the next 24 to 48 hours under observation.
All right, sweetie. I'm gonna watch you, okay? We've given him all the treatment that we can do for now. The rest is just gonna be monitoring, watching his breathing and hoping that he doesn't get any worse. Up and about.
It's been 24 hours since a life-threatening tick was removed from 6-year-old ragdoll cat, Pickles.
Wow. Hey, you want to get out? Let me have a look at you. Hey, you're the happier, stronger cat. Today's a really important test for Pickles. I need to see if he's getting stronger, how his breathing is. I just hope that he's made some improvement today. Sounds good. You're breathing nicely. That looks great. Sounds great. You're much stronger, look at you. Huh? Standing up. That's what I like to see. Good boy. I can't wait to show Jenny and the kids how well Pickles is doing. When she left, she didn't even know if she'd get him back home. And I think when she sees him now, she will be over the moon. Hello.
Hello. Oh no. Look at him.
Oh my gosh.
Oh, Pickles. What's happened? Oh, look at him. Hey. Oh my God. Well, Pickles is not looking like Pickles without his hair, but he's definitely looking a lot more alive. It's just such a relief.
All he's going to need now for the next couple of weeks is going to be rest at home, inside.
Inside, okay.
Only inside. Let him recuperate. It's going to take a couple of weeks for him to get back on track, but he's definitely out of the danger zone. He's just a lucky boy. Jenny, Jessie and Amy are so excited to finally have Pickles back in their arms. Even though he doesn't look quite like himself, I don't think they were expecting to get him back this soon.
See you.
See you later. Bye. My pleasure.
It's a big day for one of Chris's very special patients.
Happy birthday, Brulee. Good boy.
So today is a big day. We're really excited. It's Brulee's first birthday. We've got a bit of a first birthday breakfast for him.
Hi, boy.
Hey,
Happy birthday, mister. I definitely think that he knows it's his birthday or he's the special one today. I think he probably thinks he's the special one every day, but particularly today being his birthday.
He's come so far, hasn't he?
12 months ago, Brulee lost his mum, and Chris urgently had to try and find a surrogate that would accept the little orphan.
Ready to roll?
Yeah, we are.
All right, let's go.
The most crucial part is the next few minutes, because that decides whether Brulee has a new mum or stays an orphan.
Go right in. She's calling. Go for it. Yeah.
That's my lord.
Okay. She's drinking off the mare.
Brilliant. Brulee dives straight for the udder. That sound of him suckling is right now the sweetest sound of all.
Isn't she a beautiful mare to do that?
Brulee's first birthday is a miraculous milestone for his delighted owners.
In this last year, Brulee has probably tripled his weight. He's gotten a lot bigger, a lot stronger.
He's a good boy, Brulee. He's a scratchy boy.
He's gone from this sickly little foal, leaps and bounds into a horse that's so self-confident and almost on top of his peers, which is a great trait for a horse, to be able to show the others who's boss. I'll just have to give some to these guys, they're getting jealous. Brulee's more than just a horse to us, he's part of the family.
He's a gorgeous boy.
I never would have dreamed that he'd come as far as he has. And yeah, we're really looking forward to seeing him continue to grow into the future.
Big life ahead of him now. Reached his first milestone in life and many more to come.
He's a good boy.
Hi, I'm Dr. Danny Dusek. If you love our show and want to see more amazing stories from the Bondi Vet team, just hit the subscribe button. Click that little notification bell and we'll see you for our next video.